our Learning Collaborative for the Population Health Improvement Program, which is a New York State grant. And we'll be continuing with our bi-monthly webinars. And so today I'm very pleased that we have two representatives who are going to be talking about New York Connects, which is New York's Aging and Disability Resource Center. And our speakers today, we have Dana Corwin, and Dana is a registered nurse with the Chautauqua County Office for the Aging. She is the Director of Aging Health Services. The Chautauqua County Office for the Aging is dedicated to promoting independence, self-determination, and dignity for all seniors in our county. And her co-presenter, Hoak, is the Commissioner of the Department of Senior Services for Erie County. In this role, Randy directs the designated Area Agency on Aging. The Department of Senior Services strives to enhance the independence, quality of life, and well-being of area older adults through the provision and monitoring of community-based services and supports. So I just wanted to remind folks that everyone is going to be muted, and if you have questions, to please type in the questions in the little chat box, and we'll be taking those questions at the end. I'll be fielding those to Randy and Dana. And also, this webinar is going to be recorded and will be posted on our P2 website as soon as probably by tomorrow morning. So without further ado, I'd like to introduce Dana and Randy.
Hi, good morning, and welcome to our presentation for New York Connects. We hope most of you are familiar with New York Connects, and we'd like to update everyone on the call about new developments with the New York Connects program, including how New York Connects has now expanded into every county in New York State and New York City, and how existing programs have been enhanced to meet the BIP requirements. As she said, I'm Dana Corwin, and I'm with the Chautauqua County, and Randy will be flip-flopping slides with me. He's the Erie County Commissioner of Senior Services, and we both oversee the New York Connects program in our respective counties. Some of our area agency on aging directors and commissioners and partners in the New York Connects programs serve as members of your Population Health Improvement Program, or FIP group. We understand that your group is comprised of the 8 western counties of New York and are a diverse representation of local government, education, agencies, providers, advocates, and community-based organizations. Your work in the FIP group is centered on the triple aim of better care, better population health, and lower health care costs. So let's get talking about New York Connects. Next slide.
So before we start talking specifically about New York Connects, I want to tell you a little bit about the Area Agency on Aging. Many of you are familiar with the Area Agency on Aging and the work that we coordinate in the community, but for those of you who may not be, just very briefly, the Area Agencies on Aging in New York State and across the country come under the authority of the Older Americans Act, which was just recently reauthorized and signed by President Obama. In New York State, each county has an area agency on aging, virtually every county in the state. Some of us call ourselves the Office for Aging, the Area Agency on Aging, Office on Aging, Senior Services, etc. What's important about today's discussion is each area agency on aging in each county in New York State hosts, sponsors, or contracts for New York Connects. Next slide.
Okay. So what is this New York Connects? New York Connects is, as they said initially, is New York State's Aging and Disability Resource Center, or what's known as an ADRC. Since its start in 2007 in the state, it's been given the name New York Connects, but it has been called a no wrong door or a single point of entry. And any of these names imparts its purpose, which is entry or connection for long-term services in your community. The growth of the older adult population and the characteristics of this population has increased the demand for information. Today, older New Yorkers and their caregivers face a complicated array of choices and decisions about a variety of issues, such as health care, housing, financial management, transportation options, nutrition, and long-term services and supports. The list is almost endless, it seems. Federal, state, and local programs are administered by a multitude of different public and private agencies that have differing requirements to be eligible or to even access. People in need of care and their caregivers often need help to know what services are available, how to access them, and whether they qualify. New York Connects consists of the following fundamental components listed on the slide. With information and assistance, there is a standardized comprehensive screening process at the local New York Connects. Information and assistance specialists provide specialized counseling to help consumers make informed decisions and can assist them in accessing available long-term services and support options to meet not only an existing need, but possibly a future long-term service and support need. Local New York Connects programs provide information assistance on available long-term services to older populations, individuals of any age with a disability, and caregivers. Information and assistance is available in various ways, including telephone access, face-to-face meetings, not only in our offices, but in the community or in the client's home, or by email. Additionally, there's an online resource directory of providers of long-term services and supports, and information about the different types of such services and how to contact them for the local programs. There's a website associated with New York Connects we'll talk about a little bit later, and that'll be in the PowerPoint for you to look at if you haven't already had a chance to search the New York Connects database. It went statewide in the fall, late fall of last year, and it's going to be continuing to improve with some searchable components as they roll out from the state. New York Connects is focused on New York communities, but if needed, they could connect to other services or agencies that cover other areas of the country. The enhancement of the information and assistance process is the development of this new core assessment tool. And this tool was developed with input from state levels of the Office for the Aging, the Department of Health, the Office of Mental Health and Hygiene, and the Office of Persons with Developmental Disabilities, as well as regional independent living centers. So you can see that the tool encompasses a lot of needs in an effort to pinpoint the very exact service that the client may need or be asking for. New York Connects serves as a central intake for several services in the community, including the ISAP Home Care Program, which is a non-medical home care program that stems from the Office for the Aging. It can also do central intake for home-delivered meals and what I'll call managed long-term care Medicaid home care. With the changes in Medicaid over the last year, locally, many counties have what they call CASAs that in the past had dealt with Medicaid-funded home care. And with the change with the Medicaid redesign, there's some services that are provided locally through a local CASA, and now most clients that need long-term services in the community are processed through managed long-term care programs. The next item is public education, and this is a core component of outreach. We do outreach to increase the visibility of the program, so talking with you all today and making you have a greater understanding of the scope of services, and talking with the community and providers to alleviate the misconception that long-term services and supports can be delivered only in institutional settings. And I know it's hard to believe, but there are still some people that think long-term care and they associate that with a nursing home admission. But there are a lot of options nowadays. We work very closely with hospitals, with nursing facilities, primary care physicians, and community groups to navigate the complex discharge needs and educate them to the long-term service and supports and a greater understanding of the difference between certified and licensed home care. Many New York Connects programs have formal care transitions programs, and all New York Connect programs assist facilities, patients, and caregivers in coming home, whether it is care in the home, transportation, or home-delivered meals. New York Connects enables us to bridge the gap between transitioning from formal level of care, like a hospital to home, or a nursing home to home. The third component is the long-term care councils. New York Connects was the first program of its kind to initiate long-term service and supports reform through the creation of local long-term care councils. Long-term care councils in each participating county are made up of consumers and caregivers, providers, advocates, government representatives like the AAA or Area Agency on Aging Director and Department of Social Services, and key stakeholders who come together to analyze the long-term service and support systems and identify gaps, look at duplication, and look at barriers in the system, and then together as a group make recommendations for improvement. The councils can use their findings to work toward a system that is streamlined, efficient, and responsive, a system that helps consumers remain at home and in the community. The AAA remains the focus of better health outcomes, better care experience, and lower health costs. And then the last item on this slide is options counseling. And options counseling, if you're not familiar with it, excuse me, is an interactive, person-centered process whereby individuals are supported in making informed, long-term support decisions based on their preferences, their strengths, their values, abilities, and resources. It includes exploring options and assisting with accessing support services, following up with the individual, and may result in the development of an action plan. Options counseling is done face-to-face in the office, in the community, or in the home. New York Connects tries to assist the client in assessing the big picture and how different services may lend themselves to solving their stated problem. If a client says they are really struggling and don't appear to have an understanding of how to go about enhancing their community or home environment or obtaining help for areas of concern, this is where options counseling works the best. Next slide.
So we want to talk just a little bit about the history of New York Connects, how it got started, where we are today, and then we will talk a little bit later in the presentation about where we're headed. Really, this goes back to 2006, 2007, which at the time, it was a unique partnership between the New York State Office for Aging and the New York State Department of Health. This was also in response to federal pressure to reduce costs, along with the Berger Commission and the Federal State Health Reform Partnership. While New York Connects was being created and designed, it was based on this Aging and Disability Resource Center concept at the time. And the local implementation was by the Departments of Social Services and Offices for Aging, or Area Agencies on Aging. As Dana mentioned, some of the current information and assistance services and direct referral to Meals on Wheels, personal emergency response services, Office for Aging and Medicaid home care, health insurance counseling, and other items as well. Next slide.
Okay. So the Population Health Improvement Program work goals, as we understand them in your blueprint and implementation plan, are the ones listed on the screen: chronic disease screening, healthy communities, mental and emotional well-being. And your work has led you to these three goals, action items and steps, and anticipated outcomes. And what we'd like you to know is that New York Connects can assist you and your communities in many ways to reach these goals and keep FIP working towards the overall goal of promoting health to achieve the triple aim: a collaborative and community-informed manner that magnifies and aligns existing efforts and generates new and innovative strategies. New York Connects is in each of your counties and is part of the Balanced Incentive Plan that requires the No Wrong Door, or New York Connects. With chronic disease screening, this is something that New York Connects can assist with by informing our clients about local opportunities for heart disease, diabetes, and cancer screening opportunities. We may also be able to discuss with the client other local opportunities that may assist the goal of screening, such as chronic disease self-management program classes, nutrition support, health insurance coverage opportunities and choices, transportation barriers, health clinics, and primary care information. The New York Connect staff is specially trained not to look at the information request, where can I go to get that done, but dig deeper to see if other services may complement or increase the likelihood that the client will complete the task. With regards to healthy communities, including nutrition and exercise, this is where the operators can work with the clients to gain an understanding of the programs and opportunities for exercise and health in their communities. Knowing their strengths and preferences increases the follow-through on initiating and maintaining a behavior change. New York Connects can locate services to help them reach this goal, including things like home-delivered meals, exercise, dining out programs, excuse me, SNAP, or Supplemental Nutritional Assistance Program, registered dietitian consultations, chronic disease self-management courses, and health insurance counseling information that may be able to promote coverage for exercise classes or gyms. Those are additional ways to tackle the problem. Additionally, New York Connects can initiate several of these type of referrals while directly on the line with the client, eliminating wait time and possible dismissal of the task. We help the client understand how these other services may lend themselves to the goal of healthy communities. For instance, what health insurance companies cover a gym membership or an exercise class, and how would they get there? This deeper dive answers the questions of where can I exercise, how do I get there, and how do I pay for it? All very important questions to people in the community. The third item, the mental and emotional well-being, can be addressed as New York Connects works with a client to identify services and make seamless connections to mental health services in their area if available. The standardized core assessment tool that was developed with the Office of Mental Health and Hygiene and the Office of Alcohol and Substance Abuse Services is important in this aspect because it identifies areas that may trigger the need for services and a more in-depth conversation. The type of services that New York Connects would be able to refer to would be counseling, crisis services, support groups, both for the client or caregivers, mental health first aid courses, Narcan treatment courses for family and caregivers, and other factors that may be a barrier to following through on mental and emotional well-being, such as transportation, cost of insurance, or convenience. New York Connects is working with state and local agencies with mental health, with alcohol and substance abuse, with OPWDD, and independent living centers to create those seamless linkages and barriers and strategies we're taking a look at so that we can figure out how to mitigate them in the referral process. The goal of this entire team is to quickly identify one of those specialty areas and move the client to the local expert source of services. Next slide.
So we know that all these initiatives are not operating within a vacuum, and we know that the work that is being coordinated by area agencies on aging under New York Connects shares a direction and commitment to reduce hospitalizations, reduced ER visits, and of course the triple aim. The Balancing Incentive Payment Program has funded a significant role for New York Connects moving forward and has brought the formal designation of New York Connects as the Aging and Disability Resource Center in New York State, serving older adults and individuals of all ages with disabilities. So we certainly see New York Connects as a resource for all these initiatives from BIP to FIP to DISRIP, and we also see an evolution of New York Connects to meet the needs of this changing world. We're going to talk a little bit later about New York Connects and Medicaid managed long-term care plans and some interesting work that we're conducting in Western New York. Next slide.
Okay, so as Randy mentioned, and I actually wrote BALANCE, it's Balancing Incentive Program, is a collaboration with the 4 agencies listed there. And New York's participation in the BIP has committed New York Connects to the following items listed there. We've talked about the no wrong door single entry point. The no wrong door should be important to you because utilizing New York Connects to obtain long-term services and supports for your community will improve the triple aim outcomes of our communities. Sorry about the frog in the throat. The Balancing Incentive Payment Program is providing financial incentives to states to increase access to non-institutional long-term services and supports. And in an effort to do that, keeping people at home independent and safe as long as possible is the goal. Having the No Wrong Door system for people to obtain information on Medicaid is important as we expand the population. In New York State, we already had an existing ADRC to do this, as Randy said. It's now been extended to all counties and New York City. In addition, New York Connects has expanded its ability to work with the Medicaid population by working with Maximus and the managed long-term care providers, as well as the other programs that are rolling out under Medicaid redesign. New York Connects utilizes that core standardized assessment instrument we talked about in an effort to streamline access to long-term services and supports. Doing this allows for less fragmentation and communication between agencies because the tool will be housed as the front page of what's called the UAS, or the Universal Assessment System. Other agencies that are required to utilize the UAS will be able to pull this data forward from New York Connects in their work with the client, decreasing fragmentation. Individuals accessing the system experience the same process and receive the same information about Medicaid-funded community long-term services and supports. And that's good. With conflict-free case management, this means that New York Connects eligibility determination is separated from the direct service provision. We can talk to people about the guidelines for different programs and see if they're eligible, and we can assist them, but the determination is separate from us, so there's no conflict at all to promote or move people in a certain direction. This prohibits the same staff from providing the information and assistance, including options counseling and Medicaid assessment or determination. The staff functions and services are separated. Next slide.
So among the, as New York Connects continues to evolve from a single point of entry to a No Wrong Door hub, we are increasing partnerships, collaborations, and aligning systems with other partners. This is also leading to an increased volume and a diversity of information and assistant requests. No longer are we telling people that we can't help them if they're in a long-term care facility and to call us when they get home. We realize that often they are in need of services now in order to get them home. So this brings us in front of more Medicaid and Medicaid-eligible individuals. Also driving the expansion of New York Connects is a new statewide number. As you all know, in Western New York, if we were to publicize 8 separate numbers for New York Connects, that would be very difficult to publicize and reach out to the public that is in need of our services. This statewide number will be a resource that we can use to drive traffic and referrals to New York Connects and to the appropriate agencies to deliver the care that is needed. Additionally, the resource directory that Dana had mentioned has been revamped, and we are in the process of populating that resource directory and making it a valuable resource for providers, for professionals, and for older adults and people with disabilities. Next slide.
So why a No Wrong Door? What's going to bring you to this No Wrong Door? The slide lists a number of things, and we'll go through each one. We want to be able to improve access to all of the available options, and New York Connects can do this. In my notes, I wrote New York Connects can do it all, but that's probably a little biased. But as Randy said, there's no wrong request. If someone calls New York Connects and it's not about a senior or it's about something that's not kind of your mainstream request, they aren't funneled somewhere else. The request is identified. There is some research done, conversations had, and information given and referral if necessary. So there is no wrong request. It is a one-stop shop, and we are connected through our specialty hubs to those 3 critical areas that we identified as mental health, people with developmental disabilities, and independent living centers that provide services for disabled people under 60. So we cover the entire gamut from birth to death, we say. The main intake for many of these services is through New York Connects in our county. So we take quite a few referrals for several different services directly on the phone, and we process them immediately. And the immediate referrals are really, really effective. We always give the caller choice. We can direct warm transfer you, we say, directly over to X, Y, and Z, or if it's not a good time, we can give you the information and you could call at your convenience. And then we document this, and then we follow up to make sure that they did, in fact, reach their goal and make a connection for services. Not everybody follows up all the time. So it's a good piece to have that aspect of New York Connects to say, we talked and you identified a need and we talked about different options for you. Where are you? Are you okay? Did you receive the services? So that piece is really important. It decreases the fragmentation in service delivery. By utilizing the front door screen or the no wrong door screen on the universal assessment system, it makes continuity really very easy. The referral process, we have a couple different innovative projects going on in our county, like a community report card or what we call a health information exchange, where we have a direct communication electronically with New York Connects from several different providers, hospitals, and nursing homes, so that they have a way to communicate easily and quickly with us about services they would like for their clients. It helps consumers identify alternative services to prevent or delay the need for institutional care. There's been a lot of information, including the POMP studies several years ago, that talked about the services in the community that, when in place, could stave off the rise of that particular person to a higher level of care for a certain amount of months. And I don't have the numbers in my head. It's been a couple years. But the process and review of the data throughout the state showed that utilizing the correct service at the correct time in the community was not only most times the least costly, but it was the most effective care to keep the person at home for as long as possible as a viable community member, still partaking of services and paying taxes and living well in the environment that they would like to be in. It improves the quality of life through early intervention and prevention. Again, connecting people with services that assist them with their deficits in their own environment is always going to improve quality of life. We hear over and over again feedback from our clients for any types of services across the gamut about how that service has impacted their life and their ability to remain in the community. And again, that speaks to the cost effectiveness. People want to stay in their home throughout their life, most people, and these home and community-based services are the least costly. And the coordinated care that comes out of New York Connects allows for better outcomes. Better management in the home and community should translate to the reduction in hospitalizations, which is the DSRIP goal, overarching goal. So there are quite a few things here that really outline and illuminate why a no wrong door process and program is really important to your work with FIP and your local communities. Next slide.
So we talked about Aging and Disability Resource Centers, or ADRCs, and we talked about why that is important as the designation for New York Connects in New York. But I wanted to take just a minute here to talk about what ADRCs look like at a national level and where you can find some resources on them. And I believe this is extremely important now as healthcare reform is identifying needs and gaps all the time. ADRCs can be helpful and are helpful in similar efforts and initiatives across the nation. It's important to know that New York Connects, as the ADRC, is your partner in addressing these needs and gaps. I would recommend, if this interests you, or if you're looking for ideas as far as how New York Connects can be helpful to serve your population, to complement your program or an initiative that you are working on, to check out the Technical Assistance Exchange. That has been very useful to us as we have continued to guide the evolution of New York Connects and work on some new projects that have increased the local capacity and driven some significant savings to healthcare system and to Medicaid. Next slide.
So with the ADRC, or Aging Disability Resource Center, the idea is that it's going to enhance the delivery of long-term care services through this coordinated system of unbiased and comprehensive information and assistance. New York Connects is designed to be conflict-free choice for the client. Many New York programs are also working to include and improve follow-up on referrals and service startups, and that's an important part of the evolving program with New York Connects. The ADRC leads individuals of all ages and their caregivers needing those long-term care support services to the necessary services regardless of payment source, be it private, public, or a combination. Ideally, the right service at the right time keeps individuals independent for as long as possible. It is our job to connect the client to the right service, and we do this by follow-up. We do this by feedback from surveys, and we do this through the institution of the specialized program called Options Counseling. The ADRC program should raise visibility about the full range of options that are available. With constant public education, we are moving this agenda forward. There are still people who do not know what New York Connects is, and the more people know, the better. We constantly get feedback from clients. I wish I knew this sooner. I'm going to share this with everyone that will listen. And can you come and talk to my group, be it a church group or a civic group? Because even though we work very hard about, kind of getting the word out about New York Connects, and it's expanded all over the state now, and there's a statewide movement to enhance the program, there are still people out there that just don't know about it. And I was just recently talking to our director here in Chautauqua County. It seems as though, you've got a program, be it a grant or a program, it gets started, and everyone's gung-ho and things are going well. And after a while, things start to fall off, and people kind of revert back to kind of the same patterns that they were doing before, for whatever reason, call it human nature. And that's the time when we as New York Connects programs have to get out there and beat the bushes again and say, remember, this is in place, it's part of the larger system, and it works for you. We put together a senior services handbook, and I imagine many counties probably do a very similar thing, in an effort to be able to give information out about our local Office for the Aging. And over the years, we've kind of refined the different sections about information, and instead of putting, Meals on Wheels number and the local CASA number, we've reverted to putting call New York Connect, because there's only one place you need to call, and we can connect you with all of those things. We'll still share the information with regards to the primary phone number, but it's an effort to funnel people in so that New York Connects can do the thing that they do best, which is talking with people, helping them identify the service that they need, and then working from there to pull in other pieces of the pie that they might not even have discovered yet. So it's really kind of fun and exciting work, and I know that sounds very geeky, but it's very true. So we continue to raise the bar with visibility and information about the ADRCs. And in doing that, we help people move easily across public and private long-term supports and services. Many referrals can be done electronically, and assistance with applications is always available. This becomes easy for the consumer, and we quickly connect services and clients. And if we don't know, we let them know. This is a new one for us, and we're going to have to research it and get back to you. And every once in a while, we do get stumped, and we powwow together and figure out how to best address the need that's been identified by the client. So we've got a lot of work going on here with the ADRC. Next slide.
Dana, I'm going to suggest that we just advance to slide 14, just in the interest of time.
Okay.
And I'll kind of combine what I was going to say in 12 into 14, if you would.
I can do that. Let's see.
So we've talked about local system reform. We've talked about aligning systems, and as part of that No Wrong Door hub, we're bringing in OPWDD and the Office of Mental Health as more collaborative partners, integrating those service systems with New York Connects. But also, as far as the single access point for services, we have the New York Connects helpline, which we've discussed. But another important part of New York Connects is the Long-Term Care Council, where we bring stakeholders together to look at our local systems and recommend changes. Again, that as we've talked about, New York Connects is evolving. Our long-term care councils are evolving. In Erie, we have 4 meetings a year. 2 of those meetings take place with the Niagara County Long-Term Care Council so that we can take advantage of regional opportunities to better serve older adults and folks with disabilities of all ages. And really, at the Long-Term Care Council is the opportunity for stakeholders and community partners like you to help influence and help us design and be responsive to the needs of our communities. And Dana's going to tell you a little bit more about what takes place at the Long-Term Care Council in the next slide.
Okay. Like Randy said, the Long-Term Care Council is present in every New York Connects. It's fundamental to the program. And in our county, we meet 4 times a year as well. And the main charge of the Long-Term Care Council is to analyze the long-term services and supports, look for gaps, evaluate barriers to access and service delivery, and absolutely promote consumer-centered policies and choice. And by doing this, we're empowering clients and caregivers. And the council has a unique perspective as its makeup is government and providers and consumers and parents of consumers. It's really a multifaceted look at what's happening in the county, in the services, and then the council can facilitate legislative support if necessary for different things. In Chautauqua County, we just completed strategic planning not too long ago, and we're in the process of reviewing our plan and evaluating the outcomes. And just to give you an idea, our goals were to strengthen and enhance case management and referral services. And that was before the BIP came around. So we were kind of right on the mark there, moving towards a need to really strengthen the service with the No Wrong Door. And we also had a goal to advocate for an increase in affordable home and community-based services. Many budgets are stretched tight. Services sometimes have waiting lists, so we wanted to make sure we could use the council's perspective to move that agenda forward and really advocate for an increase in the long-term care systems. And Medicaid redesign is helping with that. And then thirdly, to address the shortage of mental health options for geriatrics and developmentally disabled clients in our county. That was a gap that we found. The Long-Term Care Council is a virtual think tank, and I'm sure it's this way in every county. It's an important tool to pull together the stakeholders and review the needs in the county from every angle, be it consumer, provider, or government. Next slide.
So now we want to tell you a little bit about some of the newer programs and some of the tweaks to New York Connects and our local service systems that are happening in both Chautauqua and Erie, as well as other counties throughout the state. But those are the Chautauqua model and a balancing incentive payment program innovation pilot program called Ready, Set, Home, which is happening in Erie. So Dana is going to tell you about Chautauqua.
All right, and I do see the time. I am a chatter. The Chautauqua model was developed with the Long-Term Care Council as a guide to understanding and collaborating services. It was designed to achieve efficiencies and expand access and coordinate and improve the quality of essential health care. Most providers are somewhat in the dark by the social needs and problems of their patients, and conversely, patients lack an insight into the medical process and the plan developed for them. Social needs impact medical needs and medical social. Only when both are better understood are medical providers and patients able to enter into a plan that will be successful. So we took a look in our county at what the medical needs were, and that's the left side of your screen, from the perspective of the medical community, and then what the community living needs were, and how New York Connects works in the community with information and assistance, options counseling, assessment, eligibility determination. And then we had a program and still do in the county called Care Transitions, which is an evidence-based program for work in the communities to work with clients going from hospital to nursing home to home or hospital to home. The whole idea is that most physicians would say that a patient's social needs are as important as their medical needs, and that when there are unmet needs in their homes, they are directly impacting and negatively affecting the health. If a service or medication is ordered but the client doesn't have access for whatever reason, the service or the medication is really useless. But with the changing models of healthcare delivery, like medical health homes and accountable care organizations, the medical management is seeking to better communicate with community-based organizations for a knowledge of home and community-based services and supports and a patient's social challenges. New York Connects can assist both the provider and their patient in connecting to the service or the medication in a way that's successful for both. And this is something we're particularly proud of. You know, we're working with the medical community trying to bring together and almost bridge the client in the community and the patient sitting on the exam table in the doctor's office so that they both have a better understanding and can formulate a plan that's going to be effective. In our county, we've also started a service called Chautauqua Health Connects with the Chautauqua County Health Network, and we can now link several primary care physicians, as I mentioned before, to our local New York Connects using a secure linkage and a web-based health information exchange. This is designed to strengthen the communication flow between organizations, and additionally, the availability of guided care nurses and formal evidence-based care transition models are helping to link the client and the physician to actual conditions and fulfillment of the plan of care in the home environment. It's really, really good stuff. The more engaged the client and provider are, the better the outcomes achieved. We're working on the next phase of this service, which will allow the physicians to receive what we're calling a community report card as to what service or programs the patient has completed or received. This will allow for discussion and an immediate referral for services should the team of physician and patient need and want those services. And it's an easy format to use. It makes it very simple for the patient and the physician. The Chautauqua model and the Long-Term Care Council are working to reinforce for Chautauqua County residents and Chautauqua County providers that they have knowledge of and access to affordable and integrated continuum of high-quality, person-centered long-term services and supports. That's Chautauqua County. Now Randy's going to talk.
So one project that we're very proud of in Erie County is Ready, Set, Home. And Ready, Set, Home, it was funded up until March 31st of this year by Balancing Incentive Payment Program Innovation Funds. We were one of, I believe, 4 AAAs in the state that received these, and I want to tell you a little bit about what we did. And you can see our model here on the slide, and this was titled the Extroverted ADRC. And we got this model and many of the components of this program from that technical assistance site that we mentioned earlier in the presentation. So Ready, Set, Home is a collaborative program that reduces the number of Medicaid beneficiaries utilizing an inappropriate level of care. It also facilitates timely and safe discharges of high-risk patients in subacute care after hospitalization, and has tested a model of using New York Connects to improve transitions across the care continuum, from hospital to skilled nursing facility to managed long-term care services in the community. ADRCs, Aging and Disability Resource Centers, like New York Connects, have tools to mitigate poor outcomes by overcoming the individual level obstacles that we often encounter and directly addressing system-level barriers. To date, these tools have been underutilized in Western New York. Ready, Set, Home turns New York Connects on its head. Rather than wait for consumers in need of services to call the New York Connects number, Ready, Set, Home brings New York Connects staff to places where those in need of services are most likely to be, hospitals and skilled nursing facilities. New York Connects complements discharge efforts by providing extra resources and in time counseling patients and families. This helps to overcome common obstacles related to patient fear and caregiver anxiety. And on the system level, New York Connects provides a bridge between the facility-based care team and in-home service providers, easing the process of putting services into place. We talked earlier about the gaps that we identify that healthcare reform has helped to identify, and one of those was timing when it comes to Medicaid managed long-term care plans. And we realized that people that were looking to be discharged or were advocating for their own discharge or their loved one's discharge were faced with this gap of coverage when it came to the Medicaid managed long-term care plans. Ready, Set, Home was able to address that gap and pay for services to get folks out quicker. Also, what we provide is help, resources, and short-term case management post-discharge. I've worked in a long-term care facility, and the analogy that I would use to describe the very difficult task that discharge planners often have is very similar to when we drop our children off for their first day at college in the dorm room, and we just hope and pray that everything is set up and everything's going to be okay. I saw this very same look on the faces of discharge planners as they did everything that they could to facilitate a discharge planner and send one of our residents into an apartment, and they just hoped and prayed that everything was going to be all right. Now those discharge planners have a resource in New York Connects, in Ready, Set, Home, to check in and follow up with those individuals to make sure that the services that were put into place by the discharge planner or with the case manager from New York Connects are happening and that they're effective and that this person is going to stay in the community. We are right now doing a cost-benefit analysis of Ready, Set, Home. So I hesitate to throw out any specific numbers, but we have been able to demonstrate significant savings, significant Medicaid savings as a result of the work that we've done in Ready, Set, Home, and this has really set the tone for the vision that we have for New York Connects and the effectiveness and value that it can bring to the healthcare world. And that's Ready, Set, Home.
Yeah. Great opportunity right there in Erie County. That sounds fantastic. We hope you all have come to a greater understanding of New York Connects as a local resource in each of your counties to obtain your PIP goals. And with the many changes of DSRIP and BIP and MRT, New York Connects is here and has been and is ready to serve the state's information and assistance needs. With the collaboration of the New York State Department of Health and the Area Agency on Aging, Mental Health, OPWDD, this powerhouse team is focused on the delivery of New York State needs and goals and will continue to work towards the enhancement of the New York Connects program, otherwise known as the Aging and Disability Resource Center here in New York. Thank you. And I'm hoping it'll take a moment to transition over to our host, and if there's any questions, we're happy to take them.
Thank you so much, Dana and Randy, for the fantastic presentation. So if anybody has any questions, you can post them up into the little chat box in your webinar, and we'll just take a minute to see if anybody types in any questions. We did get a comment that said, wonderful presentation.
Thanks.
And I agree with that. I also wanted to remind folks that this webinar was recorded and it will be posted to our P2 website. And we are not seeing any questions coming through, and I can pretty much say that because you covered a lot of ground and it was very well presented, and I certainly learned a lot. So thank you both very much for taking the time to present to the group this morning. And thank you, everyone, for attending today's call. And, oh, I'm seeing we do have a question coming in. Okay. So here's a question. Is the Ready Set Home program for Medicaid eligible beneficiaries only?
Yes. Yes, it is. Right now we are working with Medicaid eligible beneficiaries. However, if somebody's not Medicaid eligible, they are referred to our ISEP program that Dana referred to. That's the Expanded In-Home Services for the Elderly program. And under that program, we can often coordinate the very same services that would be covered by a Medicaid managed long-term care plan.
Mm-hmm. And I would echo that with Randy. We have worked in our county to work with current Medicaid populations that haven't been able to get services under Medicaid because they might just be a service like a personal emergency response service or social adult day services, both very necessary services to keep people in the community and keep families working. And what we've been able to do is provide those services under the Office for the Aging and that short-term case management to help people transition through Maximus to pick an MLTC. Currently, we just received a PACE update in our county. I know every county, well, I guess we're all about the same. We're all Western New York, but we've been able to do some short-term management until those clients transition into managed long-term care Medicaid, and that's been very successful as well.
Okay, any other questions from the group? Okay, well, we're not seeing any come in. So again, thank you, Dana and Randy, and thank you to everyone for joining us on our call today. If you have any questions, then just please, you can feel free to email me. My email address is khall@p2wny.org, and we will be posting the website or posting the webinar to our website very soon. And thank you again, everyone, and have a fantastic day.